In a connected world, we've gained new tools for human rights advocacy through Facebook, Twitter, YouTube, and other platforms. We now have direct and immediate access to policymakers, press, and especially the engaged public. We can leverage these millions of followers and ask them to take a specific action. Digital advocacy has become another way to shine a spotlight on human rights abuses, to help mobilize global audiences, and to apply pressure on governments, corporations, and others in positions of power. We'll look at how Human Rights Watch incorporated digital advocacy into a campaign to stop the practice of shackling in Indonesia. First, I'm talking with Shanta Rao Bariga, Director of Human Rights Watch's program on disability rights. I start by asking her what we found in Indonesia. Shanta, can you tell me a little bit about the issue of shackling in Indonesia and the findings of your research?
Absolutely. Our team worked for the past year and a half on documenting the practice of shackling, or what's called pasung in Indonesia, where people are chained or confined in small spaces for even months, years at a time, simply because they have a mental health condition or a psychosocial disability. Chances are high if you have a psychosocial disability or mental health condition in Indonesia, you'll be locked up or put in chains, either in an institution or by family members in goat sheds, in chicken coops, and even in a room in the home. And in fact, there are about 18,000 people with psychosocial disabilities who are in pasung, in shackles, in Indonesia right now by the government's own estimate. And it's likely even more than that.
So that's an incredible number. Is this legal?
No, in fact, as far back as 1977, the government of Indonesia passed a ban on shackling. And so, in fact, it is against the law to do so, but because there really aren't any resources in the community for people to get services for mental health conditions such as schizophrenia, depression, bipolar condition, families feel like they have no choice but to resort to going to traditional healers, who often recommend that they give their loved one a herbal concoction or lock them in chains, or they themselves put them in these kind of conditions in local community traditional healing centers. Our main goal was to enforce the ban on shackling and to make sure that the government was actually taking the steps needed to monitor these institutions and to impose the regulations on the people who are committing these kinds of abuses. But we also were urging the government to invest in community-based mental health services and ensure that medications were available in community health centers so that people could get access to these kinds of services and wouldn't have to resort to shackling.
How did you identify the policymakers that could make that happen, and who were they?
Well, we knew we would wanted to influence the Ministry of Health because they were the ones who were overseeing these institutions and they were the ones overseeing the local health centers. The Ministry of Social Welfare, also a really key advocacy target because they were also very much involved in overseeing the institutions where people with disabilities are kept across the country.
So walk me through your advocacy strategy. What were the key components of your efforts to influence the government?
Well, first of all, we wanted to document the findings in a robust report that could really prove that this practice of shackling was still happening on the ground, despite the ban and despite the government's efforts to address them. We also knew that we wanted to get strong media coverage on this issue because the photos are so compelling, the issue is so compelling, and really no one could argue that shackling someone is okay and is not a human rights abuse. And so we organized a press conference in Jakarta with a packed room and journalists from international media as well as local media, where we included the voices of people who had been shackled. We were able to invite one young man named Agus, 26 years old, who was locked up in a sheep shed for 4 years. He built the shed himself with the intention of actually buying sheep and selling them. And instead, his family sold the sheep in order to take him to a traditional healer. And that traditional healer declared that he was possessed by evil spirits and urged the family to lock him up in the very same shed that he built. He couldn't stand up in the shed. He slept there, he ate there, he went to the bathroom there, and he lived there, if you can call it living, for 4 years. And he told us at the press conference, and it really took a lot of courage on his part, and he said how he never would want anyone to experience what he did, and that's why he was telling his story. But he not only told us in the room, he also told CNN in a private interview, and he told a number of other media outlets who were there at the press conference, and it really helped get us a lot of media coverage on this issue. We also, as part of our strategy, knew that the journalists would want to see for themselves and actually document the shackling. So we handpicked about half a dozen media outlets, and we gave them exclusive interviews in the lead up to the press conference. And we also gave them a place that they could visit, facilitated that visit. We gave them the contact details so they could go out and document the shackling in various institutions, in various communities. And so that, I think, really helped also generate a lot of media coverage and helped with our advocacy, because journalists were really eager to capture their own stories on this, in addition to quoting Human Rights Watch's report. And the third component of our advocacy strategy was to have meetings with government officials. So we met with Ministry of Health officials, Ministry of Social Welfare. We also met with the heads of some institutions. And it was really important for us to hand deliver those recommendations to them and explain to them what we found and what are some of our recommendations that we think could help move this issue. In fact, we actually had a really great reception from a lot of the government officials. They acknowledge that it's a problem. They recognize that it's a black mark on Indonesia's human rights record, but it's an area that they're actually willing to engage and willing to do something on. And we think that there's some good traction that we can build on.
Mm-hmm. So Indonesia is a country where there's a lot of social media use. Mm-hmm. How did you incorporate that into your campaign?
So another key aspect of our advocacy was to do a digital advocacy campaign in Indonesia. As you said, there's a huge social media following. They're very active on Twitter, very active on Facebook. And we wanted to take advantage of our social media network with millions of people who are following Human Rights Watch's work to really engage the public. Particularly because this issue is so compelling when you look at the pictures or you see the videos and you see how people are chained, and no one can say that this kind of abuse is acceptable. And we knew that there was a soft spot in the government in terms of them being influenced on this issue. So we thought we would engage the public, and we did so in a couple of different ways. One, we created a Twibbin, which is a filter for your profile photo. And it allows you to show your commitment and solidarity with an issue. So we created the hashtag Break the Chains, and a Twibbin that has these chains on it that are broken, and asked people across the organization, but also across Indonesia and all of our advocacy targets as well. And even some government officials added the Twibbin on their profile photo, which was really great to show the solidarity with this campaign. And in addition, we called on the general public to send an email or send a tweet to the Minister of Health herself. We called on her to allocate medication for mental health conditions to the local level, because one of the big problems is the medication's stored up in Jakarta, in the capital, and isn't making its way into the community, and thus the lack of services and medication that people have access to. So we felt like this was one tangible and concrete, time-oriented ask that we could make, and that was really key for us in deciding how this digital advocacy campaign would be built, is that we wanted something really specific and something that we knew the government could do within a relatively short period of time. What was really exciting is that she got, I think, about 2,000 emails, and we had about 1,000 people change their Twibbin profile. Our video that we did, which tells the stories of the people themselves and shows some of these images that are quite shocking, went viral and had about 2 million views within the first few days that we released it.
So what kind of impact do you think those 2,000 emails had on the minister?
Well, our executive director met with the minister just a few weeks after, along with some of our board members, and she was aware that she had gotten those emails, and she mentioned it in the meeting, and she also actually committed in that meeting to allocating the medications from the central post to the communities, which was exactly what we had called on her to do.
That's terrific. Do you think that would have happened if there hadn't been that mobilization from individual citizens who are expressing their concerns?
I don't know. It's hard to say, but I definitely think that there was a lot of momentum. The social media was just part of it, but the report got so much press that people really knew, and I think the pressure, was there on the government to act. And I definitely think the digital advocacy campaign was one component of that pressure.
Thanks, Shantha, for sharing about your work, and congratulations on the successes so far.
Thank you so much.